Hello again. I'm sure that we are all growing more than a little weary of being told that we must make one more effort to save the NHS. This can be done by wearing masks, having injections, staying at home, not having our families for lunch, not going for picnics, and 1,000 other petty restrictions which are constantly changing and frequently contradictory. Despite all our previous attempts to comply with the various regulations, we are being told once more that the NHS is on the verge of collapse and that we alone can save it. Some people are growing a little suspicious of being held hostage in this way and having their normal day-to-day activities blamed for causing irreparable harm to the National Health Service. Some health authorities, in Lincolnshire for example, have declared a serious incident and say that they are at the point of failing. I don't doubt others will soon follow. So, what is actually causing the problem this time? Are we running out of intensive care beds? Are there so many patients in the hospitals that they are unable to cope? Are an awful lot more people dying? Exactly why is the NHS once again in danger? The answer is absurdly simple and does nothing to encourage confidence in our leaders. Despite the ever larger number of cases of COVID which are being reported each day, yesterday there were more than 200,000, the number of people in intensive care has remained stable for months. The number of deaths actually seems to be falling. Just 48 were announced yesterday, which is about a third of what they were a couple of weeks ago. And yet, still the cry goes up that the NHS is buckling under the strain. It is when you look at what is actually causing that strain that things become a little clearer. This is not a case of too many patients, but of too few staff. On New Year's Eve, 10% of NHS staff were absent from work. We are warned that this figure could soon rise to 25%. Imagine that, a quarter of all doctors and nurses, ambulance drivers, porters and other staff off sick. What are they off sick with? Have they got some debilitating illness? In almost every case, what they have is something with symptoms resembling the common cold so closely that without taking a special test, nobody could tell the difference between an ordinary cold and the new variant of COVID. Of course, at this time of year, many people do get colds, both NHS staff and everybody else. They don't usually take a week or two off work, though, when they have the sniffles. In a vain attempt to stop the Omicron variant from spreading across the country until everybody has caught it, the official guidance is that anybody who tests positive for what is now accepted by the government and everybody else to be, at least for healthy people under the age of 65, just like a cold, must stay off work for a week or so. It is this which is causing the current crisis in the NHS, rather than the disease itself. Lots of staff who are perfectly well, apart from having a bit of a cough and a headache, are not allowed to drive ambulances or enter their places of work in hospitals for longer than anybody would normally stay off work with a cold. There is, in short, a staff shortage created by the official guidelines. I say nothing of whether those guidelines are sensible and wise. For all I know to the contrary, they may well be. But there can be no doubt that it is those guidelines which are at the moment causing the crisis in hospitals rather than the illness itself. This is a very odd state of affairs, and it is difficult to know quite what to make of it. The rules and regulations which were designed to prevent an epidemic spreading too rapidly are now creating a crisis in hospitals which may be worse than if they had not been introduced in the first place. On the one hand, I suspect that this is simply bungling and the law of unintended consequences. But then again, it must be a great blessing for Boris Johnson that we are still all talking about COVID rather than the rising inflation, immigration, gas bills and all the other things that people are concerned about in the usual way of things. If I were in the Prime Minister's place, I might very well prefer to have a continuing crisis of this kind, which occupied people's attention almost to the exclusion of all else. I certainly would not be in a hurry to see it end, so that I had to start explaining how I had been managing the economy over the last year or two, and about the rise in national insurance contributions which I had introduced to pay for all the stuff I had been doing, such as furlough payments and the rest of it. I don't think this business is going to fade from view for a little while yet, because it really is so immensely convenient for the government.